Hi, I'm Howard Ochs, and I practice oral surgery in Queens, New York. So as we're doing more screw-in over cemented-in implant restorations, one of the things that comes up all the time is gaining access to the access channel. The worst thing you can do in a temporary stage is to fill up the access channel with composite. It just makes an awful problem where you can really just destroy the prosthesis trying to open it back up again, and it can take a really long time. And the truth is, it shouldn't take barely any time at all if you do it right. I was going to show you some of the products we like and use for this, and there are other products that can work, but this is Gingatech, which is a silicone material that we like to use in the temporary stage. This is a Teflon product called First Plug, and the company is 35 Newtons. Great company. Is two dentists, and they basically made medical grade Teflon that's in really nice, dense, packable. It's so much better than the hardware store Teflon. This is an instrument from TBS that's helpful to pack the Teflon in, and there's the other end has a little hook to remove material from the access channel. Another thing I'll do is just put a little bend on an Explorer to clear the access channel. And here we have a screw-in restoration that has a silicone in it. You could use a silicone with or without the first plug. I always use a first plug or recommend using a first plug in the final. You can use it also in the temporary stage that goes in before the silicone. And this is how long it should take to clear an access channel. I stick the Explorer in, I give a little twist, and that's it. It's clear. It's out. That's it. Takes about 2 seconds. Now, if we're putting a first plug in, we may need a smaller piece. We can pack it. And then in a final, it's nice to put like 80% first plug and 20% composite. In a temporary, I like to put less first plug and more silicone so that it stays in better. And in the final, and when you're using composite, you want a little bit of composite and more first plug. And then the Gingatech, you blow air in the access channel to get the moisture out, and then you overfill a little bit, and this just self-cures by itself in about 60 to 90 seconds. You can wipe it with a wet Q-tip, or the assistants will just use their finger, and it just self-cures in about a minute and a half. And that's my trick for filling and clearing access channels. You can follow me if you like, the Implant Doc, the.implant.doc.